Hi guys, so let's start with this very important odontogenic cyst, that is the Dentigerous cyst. So actually these are my own notes and you can just comment down so that I will share the link of these notes to you. Let's start. So dentigerous cyst is basically an odontogenic cyst. Odontogenic means that it is derived itself. Odonto means it is derived from the tooth, the lining associated with the tooth. Tooth derived cyst. The other name for dentigerous cyst is follicular cyst. Let's start with the definition. Dentigerous cyst is an odontogenic cyst that surrounds the crown of an impacted tooth. Very important thing. Dentigerous cyst is associated with an impacted tooth caused by fluid accumulation between the reduced enamel epithelium and the enamel surface. So suppose this is my tooth. Let me draw that for you. So suppose this is my impacted tooth present in the ramus. Drawing not so good, but still, and this is an enamel of, this is the lining of the reduced enamel epithelium, and here is the accumulation of fluid inside it. This is the fluid accumulated. So this forms a cyst. That is associated with an impacted tooth. This is the ramus. This is the occlusal plane. So basically this is the cyst that is associated with the crown of an impacted tooth. This is associated with the crown of an impacted tooth. Fluid accumulation हो रखी है इसके अंदर and between the reduced enamel epithelium and the enamel surface. This is the reduced enamel epithelium and this is the enamel surface. This green portion will be, obviously you know what is enamel. This will be the reduced enamel epithelium and this will be the enamel surface. So got to know what is an odontogenic dentigerous cyst. Dentigerous cyst is basically an odontogenic cyst that surrounds the crown of an impacted tooth caused by fluid accumulation between the reduced enamel epithelium and the enamel surface, resulting in a cyst where the crown lies within the lumen. Got it? I hope the definition is clear. Let's move forward. Basically, it is 20% of all the jaw cysts and 10% of the impacted teeth. Most of the teeth are impacted. So, it is the most common developmental odontogenic cyst. A very important viva question. That is, it's the most common developmental odontogenic cyst. Coming to the clinical features, it is always associated with an impacted or embedded tooth. We have learned that can enclose compound odontoma or supernumerary tooth. Deciduous tooth rarely are involved. So it presents in second to third decade of the life. Second to third decade of the life क्यों अब? क्योंकि mostly it is associated with the impacted tooth. And impacted सबसे ज़्यादा कौन से tooth होते हैं? The most impacted teeth are थर्ड मोलर्स एंड थर्ड मोलर्स हम किस एज में सबसे ज़्यादा देखते हैं? सेकेंड एंड थर्ड डिकेड, दैट इज इन द व्हेन द पर्सन इज इन लेट 20s. डन. Slight male predilection 3:2. Bilateral multiple, basically associated with two syndromes. Very important viva question. दो syndromes कौन से हैं? Cleidocranial dysplasia and Marotox Lamy syndrome. These are the two syndromes that are associated. Done. Most common site: mandibular third molar, maxillary third molar and maxillary cuspid, because these are the, why is it associated with these three teeth? Because these are the teeth that are mostly impacted. Also aggressive features, these are basically common to all the cysts. Common है ये. Bony expansion, facial asymmetry, tooth displacement, root resorption, and these are usually painless until infected. Once they are infected, obviously pain शुरू हो जाएगी and we will get to know. Hollowing out sign. Cystic involvement of unerupted mandibular third molar may hollow out the entire ramus. So when we see a radiograph, suppose this is the tooth that is the impacted one and we here see that this is the cyst. Basically अगर ये तो cyst unilocular है तो this portion out will be the hollowed out portion like this. If it is multilocular extending to the coronoid process, तो ये सारी जो bone होगी that will be absent. this entire bone will be absent and the entire ramus of the mandible will be hollowed out. So hollowing out is a characteristic involvement of the cyst in general. Coming to the radiographic features, here you can see this is the hollowing out seen, this is the impacted tooth, this is the entire hollowing out that is seen. Then बेसिकली की मेजरमेंट इसकी होती है अप्रॉक्सीमेटली 4 to 5 mm. जब ये मोर देन 5 mm हो जाती है इट्स टोटली अ सिस्ट, इट इज़ टोटली अ सिस्ट. सो suspect cyst faces more than 5 mm. Basically it is smooth and unilocular and occasionally multilocular. अब unilocular and multilocular में what is the difference? Suppose this is the impacted tooth and this will be the tooth unilocular, only one segment. Multilocular में क्या होगा? अब multilocular में we will have is, suppose this is the impacted tooth, you will have different soap bubble appearance होती है multilocular में, that is different locules present होंगे. जैसे honey bee का comb होता है like this, so it will be a multilocular appearance. May have thin sclerotic border. Sclerotic border is also a characteristic feature of the cyst. अब ये है sclerotic border absent हो जाएगा जब cyst infected हो जाएगी. Very important point to remember. Now here we have is the radiological variants of the cysts. अब central variant है. Central variant क्या है? Suppose this is the crown and इसके आसपास properly cyst present है. This is the entire cystic cavity. जो cystic cavity है that is covering the crown from all the sides. Here this is the lateral one. Lateral में क्या है? Suppose this is the crown. अब ये crown partially erupted है, तो जो part erupted नहीं है उधर वाली side पे like this. This will be the lateral radiological variant. One half of the crown follicle जो है हमारी cyst का that is dilated on one side. Here we have is a circumferential. Circumferential में हमारा जो tooth है वो impacted है and this will be the cyst. That is the cyst encloses the entire tooth. Then these are the three variants: central, lateral and circumferential. And these are the diagrams. Hope it helps. So this is the histopathology. A very very important thing and most of your marks lie here. This will be the, it is basically has a presence of reduced enamel epithelium. हमने definition में ही पढ़ा है, that is cyst is lined by enamel from one side और दूसरी side पे reduced enamel epithelium हमारी cyst को cover कर रही है, उसके अंदर present है fluid. So let's understand the histopathology. It has a presence of epithelium islands. Reduced enamel epithelium is present here. This is the cystic lumen and cystic lumen will be filled by fluid जब cyst infect हो जाएगी. Then it is a connective tissue capsule is present. It is the most easiest of the diagrams. Draw it again and it will help you. Thin connective tissue wall है, non-keratinized stratified squamous epithelium is present. Reduced enamel epithelium is present. Islands of odontogenic epithelium. Myxomatous material है. Differential diagnosis can be odontogenic, fibroma or myxoma. So here we have is the presence of Rushton bodies, a very very important viva question. These are hyaline bodies seen along with inflammation. These are called as Rushton bodies. Rushton bodies is a characteristic feature of Dentigerous cyst. Thin watery fluid होता है. Coming to the treatment is basically dependent on the size of the lesion. अगर तो हमारी lesion का size है small तो हम उसको remove ऐसे ही कर देते हैं, उसकी excision कर देते हैं. But अगर उसका size होता है large तो there is a chance of pathological fracture. Now what do you mean by pathological fracture? Let me explain it to you. This is my impacted tooth और ये है मेरी cyst. अब ये जो cyst है this has hollowed out a lot of the portion of the mandible. अब जब मैं cyst को remove करने जाऊंगी तो it will cause a damage to the bone and my bone may fracture. Since my bone may fracture, it will lead to a pathological fracture. Done. So our treatment totally depends on the size of the lesion. Large cyst, surgical drain और marsupialization, risk of jaw fracture होता है. Recurrence is relatively uncommon. Basically हम impacted tooth को साथ में remove कर देते हैं cyst के, तो हमारा impacted होता है तो it is not common. अब इसकी complications will be, first of all is most common ameloblastoma. Ameloblastoma occurs from the Dentigerous cyst, from lining epithelium, from odontogenic epithelium. Just remember the names कि क्या क्या complications हैं and nothing else. Epidermoid carcinoma, mucoepidermoid carcinoma. Done. Recurrence following. So that's all. This is basically a short question or a long question along with cyst. Like the question can be define a cyst, its classification along with follicular cyst plus dentigerous cyst. It can be a 15 marker question or a dentigerous cyst alone as a 5 marker question. A very important topic. I hope this topic, whatever I explained, is clear to you. You can write down your doubts below in the comment section, or if you just want the PDF of this topic, you can just write it down in the comment section and I will share it to you. Thank you so much. Follow, like, share and subscribe.